It could be related to medication. You cannot solve the problem by yourself. And it's important for the blood supply and also for the sensation of the areola. A cut through the chest, reducing the size of the gland, this is something which is impossible. A controlled heat is applied, and with that heat, the skin will retract. Hello everyone. Today we will talk about a topic that is bothering a lot of my male patients. It's about the gynecomastia. The gynecomastia is the medical term of an enlarged breast of a man. So there are a few reasons why you can have an enlarged breast even as a man. It could be, for example, related to some illnesses. Patients, when they have, for example, some tumors, and these tumors produce hormones that can enlarge the breast. It could be related to medication. That means for some medication can cause a gynecomastia. Steroids, for those who are using it, for example, to enhance their muscle volume and take steroids, that can cause a gynecomastia. So these things can enlarge the breast, even in men, because also the man has a gland in the chest area. But these are very, very rare cases. In most of the cases, we really don't know the real cause of why somebody has a gynecomastia. Usually it happens during puberty, or when people are getting older. Also, they're related, of course, with hormonal disbalance, or another cause could be also weight gain, for example. And then the treatment of choice, if you have a real gynecomastia, is a surgery, because you cannot solve the problem by yourself. Of course, when you go to the gym, you can reduce your body fat, you can increase your muscle volume, but really reducing the size of the gland, this is something which is impossible. So let me show you some examples in how to treat a gynecomastia. So as you can see here, this is a typical gynecomastia. Enlarged gland, enlarged fat, and most of the time also an enlarged areola, because the gland is attached to the areola. And because the gland is very temperature sensitive, depending on how the weather is, when it's colder, the areola gets smaller, and when it's warmer, then it gets bigger. And as you can see here in the side view, this is just a cut through the chest. You see from the top down, you see the skin with the areola, then you see the gland. I will mark it for you. We have the skin, then the gland by itself, this is the whitish structure, and then the fat cells, the yellow part, and then the chest muscle. So, how to treat a gynecomastia? Usually, what I do is to remove the fat with the liposuction. So, I do a liposuction in this layer to remove all the fat. But because the gland by itself is very, very dense, it's difficult to remove also the gland with only a liposuction. So therefore, when the gland is enlarged, I have to remove it with a small incision in the areola area. Usually I use the incision in the lower part of the areola, and the scars heal very well in this area. And it's hidden. Once it's healed, you don't see the scar anymore. So that means I cut in this layer, and then I can remove a big part of the gland. A big part does not mean that I will remove all of it, because I still have to keep a part of it. It has also a function, and it's important for the blood supply and also for the sensation of the areola. If you cut too much, you can create indentations, but you risk also to reduce the blood supply, but also the sensation of the areola. So cutting, removing the gland, and what I do, especially when it comes to high definition body contouring, I use the fat which I have removed, and I re-inject the fat back into the muscle, inside of the muscle, because we want to create more muscle volume. So we don't want the fat to be on top of the muscle, we want to inject it into the muscle to create more muscle volume. And in men, it's important to create the volume in the upper part of the chest. Therefore, whenever the men are going to the gym, when they do their push-ups, etc., it's about gaining muscle volume in the upper part and also in the medial part to create a nice crease in between the chest muscles. When we have a very severe gynecomastia, then also the skin will be enlarged. And therefore, once I remove the gland and the fat, I have to tighten the skin. The device which I use is Renuvion. That means after the liposuction and after gland removal, I go with the Renuvion cannula under the skin. A controlled heat is applied, and with that heat, the skin will retract. But if we have a lot of skin excess, then we have to cut the skin if we really want to achieve a nice flat chest. Of course, that means having a scar, but when you use right techniques, right sutures, then usually also the scars heal very well, but that would be the treatment of choice for a very, very severe gynecomastia. So this man, for example, he has a moderate gynecomastia. As you can see, the gland is enlarged. Also, the areola is popping out. And as you can see here, enlargement. He has also some fat depots in the underarm area, the axilla pit. So this is mainly fat. This is not the gland, this is the fat. So what I usually do is removing the fat with small incisions. The incisions are one in the axilla and one in the areola. And these incisions, you don't see them once it's healed. With that, I can remove all the fat in this part. And because in his case also the gland was enlarged, I removed the gland through a small incision in the areola area. After the liposuction, I enlarged this incision to remove the gland. This one, for example, also here you see enlarged areola, the gland was enlarged, and this is something that you can palpate. You cannot see it really, so really to determine if is it only fat or is really the gland enlarged, then you have to palpate because the gland is more dense. In some cases you need maybe also an ultrasound to see the size of the gland. And also in this case, I removed the fat with the liposuction. I used devices to tighten his soft tissue, and also through a small incision in the areola, I removed the gland. And this is his afterwards. As you can see, a very toned chest and also more volume in the upper part, because most of the men want more muscle volume in the upper part. And also here, another of my cases, this gentleman, he already had a very, very healthy lifestyle. So I did the liposuction of his tummy, hips, flanks, and the core, and removed the fat. And as also you can see here, it's important to make the chest in the outer part very empty. So in this part, as much as possible, also in the lower part. And then to re-inject the fat in this area to create more volume. And as you can see, also the crest between the muscles of the chest is more visible. Just a quick overview about gynecomastia, the causes, and of course the treatment options. In case you are more interested, please follow our other pages and also the homepage. And in case you would like to have more personal information, don't hesitate to contact us and book your consultation. I'm very much looking forward to see you maybe in person.